You're watching this video because a doctor wants you to understand what's involved in a craniotomy for infection. Potential infection has already been identified within or around the brain. The purpose of this emergency surgery is to remove as much of the infection as possible and obtain a sample to analyze in the laboratory to guide further treatment. The patient is usually positioned on their back, side, or front, depending on the location of the infection within the brain. A metal head clamp may be used to hold the head safely. Some of the hair may need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will, again, vary depending on personal requirements. Sometimes 3D computing technology, like satellite navigation for the brain, is used to help the surgeon during the operation. To begin, a cut is made in the skin of the scalp. Drills are used to make a number of holes in the skull. A special bone saw with protective footplate is used to join the dots and a window of bone is opened. The incision and bone window will vary in size, shape, and position, depending on the patient's personal requirements. The tough lining around the brain, known as the dura, is then opened to reveal the brain. The surgeon will then carefully remove any source of infection and collect samples to send for laboratory analysis. There are different tools, techniques, and equipment that may be used depending on what they encounter. It's not usually possible to remove all of it safely, especially if it's stuck to the brain tissue. An important aim of the procedure is to get an accurate diagnosis to guide specific antibiotic treatment after the surgery. If the brain is visibly swollen, the bone window may not be replaced until a later date when it's safe. If the swelling is minimal, the bone will be replaced. There are different ways to do this, but may involve screws, plates, or bone clasps to reattach the bone. To finish, the surgeon will close the scalp with sutures or staples. There may be a drain left in place to drain off excess fluid from the surgical site, which will usually be removed in the first few days after surgery. There's usually a wound dressing, and a head bandage may be applied as well. It's likely that some of the removed tissue will be sent to the laboratory for detailed analysis. Please ask your surgical team for your personal postoperative plan after the procedure is finished, so they can give advice based on your needs. There may be a further collection of infection in the same area of the brain. This may require further surgery. When considering whether to have a procedure or treatment, you should consider the potential benefits, the potential risks, and whether there are any alternatives available, such as medication, radiotherapy, less invasive procedures, or even not doing anything at all. You should take time to ensure you've considered all of this carefully. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. There may be a further collection of infection in the same area of the brain. This may require further surgery. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF, or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.